Okay guys, I empathize with you checking off on these skills in your home with limited workspace. So today I'm going to try to demonstrate the sterile suction, trach suctioning, and then cleaning and care. Okay, so for this procedure you will need the suctioning, you will need the suction catheter kit, you will need sterile water. I personally like to have a sterile cup and go ahead and pour my sterile saline in there, but we'll use what you have in your kit. So this is my mannequin that I created because I don't have a trach kit. This is my oxygen, okay? So you also need your PPE. So we have a mask, a splash mask, and a gown. You'll verify your physician's orders, make sure and review your patient's vital signs, and particularly their O2 sat. You will identify the patient, make sure the patient is semi-Fowler's position, make sure that your wall suctioning is functioning properly. You have your canister, you have it turned on, not more than 180, check those numbers, and your tubing handy, okay? And you'll wash your hands, identify your patient, explain the procedure to the patient, put on your PPE, open your kit, got our gloves. This is my bedside table, this is my patient's bed, okay? So, putting our sterile gloves on, then this one is ripped. Okay. In real life, we would not use these gloves, of course, because they wouldn't be ripped, because they wouldn't be open yet. Okay. So, then you've got your little container here. Both hands are sterile at this point. Okay. Now, I like to sit this right here, and then get my catheter. Both hands are still sterile. I'm going to hold this with this dominant hand, which will remain sterile. My non-dominant hand will become non-sterile or contaminated. So at this time, I will connect my suction tubing, okay? Now, this is no longer sterile, it's contaminated, okay? So when you have your thumb over this, it is suctioning. When you remove your thumb, it is not suctioning. So, we are going to remove this without letting it touch our contaminated hand. Wrap it around, okay? You're going to ask your patient to hyperoxygenate. Take 5 or 6 deep breaths with the oxygen on. You're going to put the tip in to moisten, okay? And you check your suction functioning properly. Move your oxygen supply over, but keep it close, okay? Then you do not want to suction while you are advancing the catheter. And you advance the catheter until you meet resistance or the patient starts coughing. Then you slowly remove, and you want to twist this around so that it doesn't come out and flop on the patient's chest, okay? Okay? Immediately, put your patient's oxygen back with your contaminated hand, have them hyperoxygenate again. And then if they need suctioning a second time, our checkoff sheet says we can do that a second time, but that's all. And you do not want to suction more than 10 seconds at a time. So again, have them hyperoxygenate, move it, okay, with your sterile hand, insert until they cough or you meet resistance. That's why you want to hold it, okay. Then we're going to suction 1, 2, 3, 4, 5, 6, 7, 8. Okay, so we can't do it again. So we ball it up, put it in our glove, throw it away. Wash our hands, check our patient's oxygen saturation, auscultate their lungs, wash our hands again, leave the room and document the findings, either in the computer in the patient's room or back at the nurse's station according to your facility's procedures. Okay.